All right, we've all been there, right? A patient comes in and says their food just tastes like cardboard. It can be super frustrating for them and honestly a bit of a puzzle for us. So today, we're going to build a solid clinical framework to tackle these really common but, often overlooked conditions. Okay, here's our game plan. We're going to start with why this is such a big deal. Then, we'll do a quick dive into how it all works, what goes wrong, how you evaluate your patient, and finally, how to manage it. Let's jump right in. First up, the overlooked senses. Seriously, why does this matter so much in your day-to-day clinic? Well, the numbers are pretty staggering, and the impact on a patient's quality of life and their safety is just massive. So get this, nearly 80%. By the time someone hits 80, almost 80% of people have a real, measurable issue with their sense of smell. This is not some rare niche diagnosis. For our older patients, this is basically the norm. And this chart just lays it all out, plain and simple. Just look at how that green area, which is normal smell, just shrinks as people get older. And at the same time, the orange and red parts, that's smell loss, they just completely take over. It's a really clear progressive decline we're seeing. And look, this is about so much more than just food tasting bland. We're talking about a serious safety issue. You can't smell a gas leak or spoiled food? That's dangerous. It can lead to real malnutrition and significant weight loss. And what's absolutely crucial for us clinically is that it can be one of the very first clues for major neurodegenerative diseases like Parkinson's or Alzheimer's.
Okay, next section, the foundation, or how smell and taste actually work. We're going to do a quick anatomy review here because, to figure out what's broken, you first have to understand how the system is built, right? All the way from the nose and tongue up to the brain. So what we think of as flavor is really a team effort. It's a two-part system. Over here on the left, you've got the olfactory system. Those little odor molecules travel way up into the nasal cavity and hit these special receptors. Then on the right, you've got the taste or gustatory system. That's where chemicals in your food dissolve in saliva and trigger the taste buds on your tongue for all those classic tastes: sweet, sour, salty, bitter, and umami. Okay, now this is where it gets super interesting. Look at this pathway. The signal doesn't just go to some logical processing center. No, it travels from the olfactory bulb straight into these really primitive, deep parts of the brain. We're talking the amygdala, the entorhinal cortex. This is the direct line to memory and emotion. It's exactly why a certain smell can just instantly transport you back in time or trigger a really powerful feeling. Okay, so now that we have that foundation, let's get to the really clinical part, when senses go wrong, the differential diagnosis. So your patient is in front of you. They're saying they can't smell or taste right. What's running through your head? What should be on that differential? First things first, let's make sure we're all speaking the same language. It's really important to be precise. In osmia, that's a complete loss of smell. Hyposmia is when it's just reduced. Then for taste, you've got azusia, which is a total loss. And dysgeusia, you'll hear this one a lot. That's when things just taste weird or metallic. Using the right term here is really the first step to a good workup. Listen, the full differential diagnosis can be absolutely massive, but you should always start with the big three. We're talking just plain aging, an upper respiratory infection, a bad cold or virus, and head trauma. Seriously, if you master these three, you've got most of your cases covered, right there. And here's a more structured way to break down that differential. It helps to think in categories or buckets. So first you've got problems right in the nose or sinuses. Think chronic sinusitis. Then you have your viral infections, and we've all seen a ton of this with COVID-19. Then there are the big neurologic disorders like Parkinson's. Of course, there's head trauma, which can literally shear those delicate nerve fibers. And don't forget the other bucket. That includes things like medications, smoking, and even nutritional issues. Okay, section 4, evaluating your patient, the bedside workup. So how do you put all this into practice? Your patient is sitting there in front of you. Let's walk through what you need to ask and what you need to do. So what's the most critical thing to get from your patient? It's their history. Seriously, history is everything here. Before you even think about ordering a scan or making a referral, the patient's story is going to give you most of your clues. It'll often point you right to the diagnosis. So what are those high-yield questions you absolutely have to ask? Okay, here's your clinical checklist. You absolutely have to know. When did this start, and was it sudden or gradual? A sudden onset points you towards something like a virus or an injury. Gradual is more worrisome for a neurodegenerative cause. You gotta ask about what happened right before. Any bad colds? Any head injuries?
What about other symptoms, like a stuffy or runny nose? And please, do not forget a complete medication review. So many common drugs can mess with taste and smell.
All right, our last section, principles of management. So you've done your workup, you have an idea of what's going on. Now what? What can we actually do for these patients? Let's talk about the game plan.
The management plan really boils down to these 3 steps. And number 1 is by far the most important. Treat the underlying cause. You have to go after the root of the problem. If it's chronic sinusitis, you're looking at things like intranasal steroids. If you think a medication is the culprit, can you switch it to something else? The key is to always tailor your treatment to what you think is actually going on. And listen, your job absolutely does not end with a prescription. The counseling you do is just as important, if not more so. You have to talk about safety. That means asking them, do you have working smoke and gas detectors? It's critical. For nutrition, you can encourage them to play with spices, herbs, and different food textures to make eating more enjoyable. And maybe most importantly, you have to set realistic expectations. Let them know that recovery can be slow and sometimes it's not complete. That honesty is crucial. So we're going to end with this, a question for you to really think about in your own practice. With everything we're seeing with post-viral syndromes, like long COVID, these sensory disorders that used to be kind of on the back burner, they're now front and center. Being good at diagnosing and managing them isn't just a niche skill anymore. It's absolutely essential for any modern clinician.